But first of all, the evidence that swallowing fluoride lowers tooth decay is actually extremely weak. You know, when I first got involved with this in 1996, I thought the issue would be whether fluoride causes harm, but I assumed that because everybody wanted this practice from all the professional bodies and the government health agencies and so on, that the fact that it would lower tooth decay by swallowing fluoride would be pretty clear-cut. In fact, the evidence is extremely weak. This is what one reviewer said in 1999, David Locker, and he, in a review which he conducted for Ontario Ministry of Health, the magnitude of fluoridation's effect, it means benefit, is not large in absolute terms, is often not statistically significant, and may not be of clinical significance. In 2000, the York Review in England reported that they could find no grade A studies supporting the efficacy of fluoridation for fighting tooth decay. What do they mean by grade A studies? They mean randomized control trials, RCTs, the gold standard for epidemiological studies, a randomized control trial. It would be difficult to do that on a community level, but it would be easy to do that, and they do it for every drug that comes on the market at the individual level. Some individuals randomly selected would get the fluoride, and some individuals randomly selected would get the placebo. And after 70 years, they've never done such a randomized controlled trial for water fluoridation. In 2015, the Cochrane collaboration, which again is the gold standard as far as assessing the validity of the science on medical issues, they're acknowledged as the gold standard in these kind of reviews. They looked at the evidence that fluoridation reduced tooth decay and concluded they could find no high-quality research that showed that fluoridation provided any benefit to adults, that fluoridation provided additional benefits over and above topically applied fluoride, that fluoridation did not, and there were no high-quality studies indicating that it reduced inequalities among children from different socio-economic groups, or that when you stopped fluoridation, tooth decay went up. No high-quality studies to demonstrate all those things which promoters claim nearly every day. They did concede that there were some studies which showed that water fluoridation reduced tooth decay in children, but said that they question whether these studies, which were from quite a while ago, from the 1940s to the 60s, were relevant to today. They reckon that they had a high risk of bias in those days when the issue was promoting fluoridation, and they were conducted prior to the availability of fluoride toothpaste. Not exactly a glowing report to justify fluoridation, the effectiveness of fluoridation. Certainly not enough to justify risking our children's brains. Now, going to the United States, the largest survey of dental fluorosis and dental caries in the United States was carried out in 1986-87 by the U.S. National Institute for Dental Research, which was one of the big promoters of fluoridation again. They collected dental fluorosis and dental caries data for 39,000 children from 84 communities. And this is, when you see the results, it's the story of two relationships. One relationship is very strong, and one is very weak. So here, on the left-hand side, in the green box, is the communities that are being examined for these statistics. There were those with fluoride less than 0.3, those who had fluoride levels between 0.3 and 0.7 milligrams per liter, those that were fluoridated artificially, that's between 0.7 and 1.2, and those above 1.2. So 3 of those categories are naturally occurring fluoride, and the third one is for artificial fluoridation. Well, here are the percentage of the children with dental fluorosis in this very large survey. You see that the percentage of children with dental fluorosis increases remarkably as the level of concentration in their drinking water goes up. 14.6, 19.6, 25, and 40%. On the other hand, what about the children with caries as those concentrations go up? Practically no change, 55.5, 54.6, 54.4, 56.4. So clearly you have one relationship which is very strong. As fluoride goes up in the drinking water, dental fluorosis goes up. The number of kids with dental fluorosis goes up. But as fluoride goes up in the drinking water, you don't see much difference in the percentage of kids with dental fluorosis. And similarly in New Zealand, these statistics are gathered by New Zealand School of Dental Statistics in 2016 show no difference in 2016 in 5-year-olds between those living in fluoridated and those living in non-fluoridated communities. Most